You're listening to National Health Executive's Finger on the Pulse podcast with me, your host, Matt Roberts, to guide you beyond the headlines with news, views, and insider truths from across the healthcare sector. Today's podcast is brought to you by our sponsor, Evo North, uniting leaders from the public and private sector to collaborate, share exciting innovations, and build a stronger Northern powerhouse together. Welcome back to episode 10 of the National Health Executive's Finger on the Pulse podcast. Today we're going to be discussing mental health, and we're going to take it from a very different perspective. On this podcast already, I've talked to a lot of healthcare professionals and got a real industry view. But today I'm going to talk to Nick Rowley, who has a part to play in Andy's Man Club, which is a mental health provider and sort of charity involved in Manchester, to get a sort of outside of view looking in and to really understand mental health from all aspects. So thanks for joining us on the show, Nick.
Thanks very much. Thanks for having me.
Brilliant. And I suppose we'll dive straight into it, which is, first off, obviously, as I mentioned, Andy's Man Club is quite a Manchester-based. We've got a national audience. I don't know if you could talk to a little bit about what it is you do.
For sure. So Andy's Man Club is a national charity. We've got 28 clubs all across the UK. I represent the Manchester group, so I'm one of the facilitators at the kind of the Manchester chapter of Andy's Man Club. But we are as far north as Scotland, as far south as kind of Cornwall, Devon, and everywhere in between. And really, it's a peer-to-peer kind of support network. So what that kind of looks like is it's not prescribed counselling, it's not therapy. We really try and push that there's never any kind of hard advice saying you should do this. I would recommend that you do this. It's blokes of a similar mindset getting in a room together and having a real conversation. And that's, I think the word banter gets thrown around a lot, and it can distract massively from people who are trying to have a real conversation. So what we try and do at Andy's Man Club is to remove that kind of ego, if that makes sense. And men can stop pretending to be the best version of themselves, and they are allowed to feel and be vulnerable, which is something that I know from my kind of personal experience, that men are very uncomfortable being vulnerable because of this kind of macho culture that we live in, and that kind of embarrassment to admit that you're not doing so well or that you've got problems in your life. Kind of Andy's Man Club, we really try and push that once you've walked through those doors, you can be yourself. You can take that kind of mask off that you wear for society, whether it be the mask that you wear at work or in your relationships or with your friends. You could just come and take that mask off and really open up about what's going on inside your head. The real reason for it is obviously to prevent suicide as best as we can. We always talk about that one man that might need us, but it's like I said, it's not a prerequisite. You don't have to have been diagnosed with a particular mental health condition or have had suicidal thoughts. You could just be having a bad time, and Andy's Man Club the doors are open. Quite a lot of blokes that come through, they come supporting a friend or a family member, and they come with them and say, oh, I'm here for so and so, and then kind of after a week or two they realize, they're like, Jesus, I'm here for myself as well. It's really powerful to see that happen, and it's really powerful to see guys opening up.
That sort of breaking down of and making it so open is probably quite a big thing, as well as you touched on the sort of stigma, especially with men's mental health, that we often see can make quite a lot of people maybe hesitant to sort of reach out and see traditional treatment and stuff. So maybe having those other options, I suppose, really makes a much wider sort of opportunity for those that need support or need assistance, whatever that may be, to actually receive it and be comfortable going out and getting help.
Absolutely, yeah. We talk about the kind of Andy's Man Club is part of the toolkit. I would never kind of exclude a method for people to explore healthcare, particularly when it comes to mental health. I would never kind of bash any approach, as long as it works. What works for you might not work for somebody else. So at Andy's Man Club, we try and not discuss medication too much. None of us are kind of qualified physicians, and if there are doctors or GPs in the room, we do ask that they don't kind of perform on a professional level. They're there for themselves. They're not there to dispense advice. Because of that, we don't discuss medication purely because what works for one guy might not work for another. And I say it's all about building that toolkit of having lots of different options. So, you might go to your GP for clinical advice, but then you might come to Andy's Man Club just to talk. You might go to a counsellor for real therapy. It's not, you don't have to go with just one option. It's very much cut and copy to be able to go with what you think is right for you. And it's, I think it's difficult to talk about mental health when unfortunately, you do have to break it down into gender. And it's not to say that, women don't suffer with mental health issues or suicidal thoughts. And it's completely, it's not bespoke to gender, but as a man, we're 3 times more likely to commit suicide than a woman. And I think the language that we use, particularly, the word commit it has connotations with crime, and we try and kind of educate people in how to discuss mental health, how to not be afraid of it, how to not minimize it. I think when you talk about suicide, you use the word commit, which has kind of criminal connotations from back when suicide was actually a crime. I think people struggle to start the conversation as well, because I know from a lot of people that I've spoke with, they kind of they attach themselves to the words, don't go and do something silly, or that kind of language. And it's important to be direct. There's a lot of people that that go down that thought process of, well, if you say the word suicide, you're going to put that thought into their head. And I think, trust me, if someone's feeling suicidal, you are not going to put that thought in their head just by saying the word suicide. So I think it's really important that when you are discussing it, is not to kind of pander, be direct, and say to people, are you feeling suicidal right now? And they might just, they turn around and say, no, I'm not suicidal. I'm just having a really, really bad day, and I can't see any options. But yeah, we work really hard to make sure that we don't just become one option, that people that guys open up, and they might come to us having nowhere else to go and thinking that they've got nowhere else to go, but then by coming to Andy's Man Club, they see that there are other options out there. And like I said, it's building that toolkit to be able to deal with mental health issues as and when they come up.
Yeah, and as we say, like, as part of that toolkit, to use your phrase, you see it from the very sort of personal and the human side of that conversation, the dialogue and that. As we mentioned, there are other services there for the clinical side. Do you think there's necessary enough joining up of that and enough sort of bridging between? So, for example, clinicians maybe recommending the sort of approaches like yourselves take of dialogue and talking, or is it very much a sort of, as you've said before, people unfortunately fall in the category of thinking, I need to assume one, I do one and one only?
I think unofficially, we've worked quite hard to get ourselves embedded, definitely in the Manchester community. The crisis centre in Manchester, we're on their calling cards. When guys go to there, they say, look, if you're having a tough time, have you heard about Andy's Man Club? We really try and get involved in making sure that people know that we are an option. But I think, it's also really interesting when I speak to practicing physicians and GPs and stuff who have never heard of us, and that that's not me being naive of like, Andy's Man Club must be everywhere, but there are very few men's mental health charities out there, and we work really closely with as many as we can to make sure that we just raise the general awareness. So there's quite a few dads groups that we work alongside and work with to raise awareness, because of depression in new dads is massive. It's a massive problem, and I think it's they struggle to talk, they struggle to communicate, and it's definitely attached to those feelings of being alone. You're the only person going through this. There can't be anybody else out there in the world going through what you're going through, and at the time, it's very difficult to kind of justify that as not being true. You think about yourself and where you are in your life, but then you realize that you're not on your own when you connect up with other groups, and you could be having a really, really bad day, but if there's someone that has either been through or is going through something as equally traumatic or difficult as yourself, it just gets slightly easier if you share that burden a bit, even just by saying, I'm having a really tough time.
Yeah, and that sort of honesty, as you say, is quite key. Sort of from that, I suppose, have you how have you reacted and dealt with the current situation where we have suddenly seen a lot of this communication, this opportunity? has been halted or has had to move to sort of online or digital outputs. It in some ways, has that been a problem or a challenge you've managed to overcome, or has it been quite difficult to ensure people still aren't isolated, don't feel isolated, and feel they have an outlet to talk in?
For sure, it's been a huge issue. I think it would be naive to try and hide from that. Before lockdown, we were regularly having between 20-25 guys, sometimes as many as 30, come into the Monday meets at 7 o'clock. We then had to move to online. So all of the Andy's Man Club groups across the country have moved to online groups, and there has unfortunately been quite a significant drop in numbers attending, and I think it's completely understandable. Some guys are not comfortable being on camera. They might not necessarily have the privacy to be able to speak if they're in the family home. There's loads of contributing factors as to why, and it's completely understandable to we're not going to expect these massive rise, but at the same time, we have had a kind of a separate kind of filter group for new guys to come to and say, listen, I'm really struggling. I think I could use Andy's Man Club for some help. And then they take part in that initial national kind of newcomers group. And then after 2 sessions, they're then kind of localized to where their nearest group would be geographically.
Yeah.
And not to speak kind of moving forward, I know that we're trying really hard to get back to the physical meets because we know how important they are. But I think moving forward, it's definitely shown us that the online groups are an option for guys who might not necessarily be able to attend a group on Monday at 7 o'clock, whether it be work commitments or other contributing factors that they're not able to make the actual physical meets. That we will still move forward with the online groups. All about kind of awareness and options and reaching out and making sure that guys have got somewhere to come to. But yeah, it has definitely been a challenge that we've had to overcome, and again, understandable as to why some of our guys might not be comfortable being on camera doing kind of the whole Zoom meeting thing. It's especially when you're talking about pretty life-changing stuff. Some pretty deep conversations happen. So it's we by no means are we trying to force our guys to attend the online groups. We're just again trying to do the best that we can given the circumstances that we're in.
Definitely, it's sort of that toolkit, as we say, isn't just necessarily different outputs, it's different ways to access it, and for some that may work and for some it may not. Today's podcast is brought to you by our sponsor Evo North, uniting leaders from the public and private sector to collaborate, share exciting innovations and build a stronger northern powerhouse together. That leads nicely into probably the big difficult question for yourself. As I mentioned in the intro, I've spent time talking to a lot of healthcare professionals and seeing the mental health scope nationally from internally and how within the health sector we see it. From someone who's quite heavily involved in it, but from sort of an outside perspective, what are your thoughts on it at the moment? Do you think we are going in the right direction? We have enough support, or is there still this wide gap that seems to be needing done?
It's so my personal story. I'm more than happy to share this because it's I think it's important to know about it. I tried to end my own life on the 6th of July 2015, my 26th birthday, and I woke up the next day in a hospital ward, and it was very jarring. I guess I would say someone that again, not to minimize it whatsoever, but for any guys listening, that I thought everything was going fine, and I didn't realize the pressures at work, relationships, home life was kind of piling on top of me, and I just snapped. I write quite a lot about it and happily share it, but I snapped and tried to end my own life, and I woke up the next day in a hospital ward, and within kind of 48 hours I was discharged. I had a follow-up appointment with a GP who kind of they gave me a sick note for depression, and I was off work for 2 weeks. But then after that, it was very much kind of out into the wild. And again, I would never bash any the NHS or anything like that. I think it's very easy for a man to slip through the system just by answering the questions and saying no, I'm not going to try this again. I don't feel like ending my. It's I think the kind of I was stuck in that point of pressure of being like, oh god, I just want to get out of hospital, and I didn't have something like Andy's Man Club at the time to be able to use. So it was my personal experience at that time was very much, if I just say the right things, they'll let me go. And the responsibility is absolutely on me. But at the time, I was still very much in that pressure pot of being like, oh God, guys, don't talk about this. Like, I don't want to become a statistic. I might lose my job. Like, all the kind of social factors that go into mental health and suicide, of it being a stigma, and the burden and the embarrassment that comes attached with it. I just tried to shut it all off, pretty much. And within kind of a month of trying to end my own life, I was back at work, pretending like nothing had ever happened. It wasn't until I would probably say about 2 years after that I really started to properly deal with it, and get onto a path to real recovery. And it's not necessarily about recovery and such, just kind of learning to live with the new version of me, I guess. So yeah, I think it's very easy for guys to slip through the system by just answering the right questions, just to get themselves out of the kind of the clinical side of things. And I think the responsibility is to spread the message that it's all right to feel like this, and to not to kind of rush to be back to being normal so quickly. And I think I definitely felt a certain responsibility on myself before I started looking at myself and going, right, okay, what stresses me out? My job stresses me out, so maybe I should try changing that. Does it stress me out where I live? Maybe I should try changing that. And not always looking for somebody to help me out. And that can be a difficult thing to come to realize, that you have to do a little bit of work on yourself. But I think that's kind of the crux of mental health, is that a lot of the responsibility, unfortunately, falls to the individual to be able to reach out. In the kind of immediate days that followed my suicide attempt, a lot of people kind of reached out, and I guess at the time I was thankful for it, but for 26 years I'd not reached out to anybody, and that's the situation that it landed me in. Now, as we're talking right now, you can't shut me up. I will talk about it until the cows come home, because I think it's really important to dispel that stigma, that myth that guys can't talk about their feelings, that guys can't be vulnerable. I found it liberating when now that I'm able to share my story and talk about it, and people come up to me and say, that's really powerful. And I'm like, listen, man, it's just my life. Like, there's nothing special about it. I'm sure you've got a story to tell as well, but there's a couple of hurdles that are maybe in your way at the moment, and that's cool. That's absolutely fine as well. But I think the more that we talk about it, the more that we kind of normalize but not minimize the conversation, if that makes sense. It is still difficult to talk about 100%, but the more that guys are able to talk about it in safe, confidential spaces where they know that they're not going to be ridiculed, or they're not going to be minimized, they're not going to be, felt insignificant, that their problems don't matter, that's when we're making kind of real progress. And I think it's very difficult to do that in a clinical environment, which is why stuff like Andy's Man Club is important to be part of that toolkit, because we can sit there for 2-3 hours listening to a guy pour his heart out, because we've got the time. Pretty much almost everybody that's involved in Andy's Man Club is a volunteer. There is a kind of core office team that do work for the charity, but all the guys that lead the groups across the country, all volunteers, all the co-facilitators, all volunteers. The spaces that we operate in, one of the kind of prerequisites is that we really try and push for them to be free, because we don't want to get tied into paying for space. So it's really important for us that there is no pressure, both in terms of time and financial constraints, to stop us doing what we're doing. Because once some guys can come for weeks and weeks and not say anything, but then that 1 week will hit and they share their life story, and that could be life changing for that one man. That could probably be the week that guy's life is quite literally saved. And it's just time. It's time for that individual to gather the kind of courage to open up and have their time, I guess.
Yeah, and as you say, the benefit of these sort of services, and that is that because you are volunteers, you have that connection to it. You aren't doing it for the sake of it being a job. You're doing it because you see it. Some of you have lived it. You have a passion to help these people. That with all the will in the world, and it's no question or statement to GPs not having that equal care, but they don't necessarily have the time, or they have to go through clinical procedures, which, as you mentioned during your story, was that it may be that because of the stigma, you naturally try to just get through as quick as possible. Doesn't necessarily have the time to sort of sit there and accept it. So I suppose the point of that is that we're starting to see a lot more of a conversation around patients taking more of the word is usually responsibility, but I think with mental health, responsibility sounds too much like it's their requirement, their like prerogative, but sort of taking ownership, I suppose, of mental health. And I guess the question has to be, do we then look at how sort of services and general budgets and stuff can better fund the likes of Andy's Man Club, the likes of other similar solutions, to really make sure that no matter where in the country you are, you have access to these sort of services?
I mean, Andy's Man Club would never say no to funding, put it that way. But it is. It's. I think you chose some very select words there to make sure that guys aren't pressured into talking about mental health, or people, or in general, not making it about gender, but particularly for blokes, that first hurdle can be just opening their mouths and talking about it, and the shift does have to kind of, unfortunately, fall. That we will always be there. Our doors will always open, but we can never force a man through that front door. A guy has to. Somebody, we will be stood outside waiting to bring you down and have a brew, but we can never force somebody through that front door. You have to be willing to come and try and open up. And yeah, like you said, it's you have to take the control of it, of being able to walk through that front door and say, right, I'm here for some help. I don't know what it looks like. I don't know where I'll be in 6 weeks or 6 years, but I'm here for some help right now, today. And I think it's hugely important that message is spread. That that I guess, like like your checkups that you have with a GP normally for all of your kind of physical needs. What does that look like in terms of mental needs? Do we need to kind of educate a little bit to make sure that people across the country know that it's okay to check in with themselves from a mental point of view? It's very easy to diagnose something physically. If you break your arm, you go to the doctor and you say, "What's wrong with me?" He goes, "You've broken your arm." It's very easy to do that. I think with mental health, it's a lot more difficult because there's, as I spoke about earlier, that kind of level of banter and minimizing problems. Guys can come and be like, "I'm having a really tough time at the minute," and often the words are like "chin up" or "man up," or that kind of really minimizing language that just makes blokes be like, "Oh, right, well, cool, everybody feels like that." And the truth of the matter is, yes, everybody does feel like that, but that still doesn't mean that you don't need to go and get help with it. So in terms of sharing that responsibility in helping charities like ourselves out, like Andy's Man Club, making sure that we can spread our message as far as possible to make sure that guys have got somewhere to come to, it would be hugely beneficial. Even if we could just get a little bit more involved in definitely the being options. Having Andy's Man Club flyers in hospitals, we try and get as much out there as much as we can. But to be able to get the links out there and start the dialogue from charities to the NHS to privatise medical healthcare, it would save a lot of the legwork that we have to put in. Getting out there and spreading our message, which it's massively important in everything that we do, and we'll never stop that. But if we can spend more time concentrating on how to get guys talking than we do just getting out there and getting our message out there, if the legwork is shared, it would be massive, absolutely massive.
Yeah, because we sort of hear that, especially at the moment. As you said, socially, mental health and physical health have very different situations at the moment. As you say, you break your arm, everybody knows you've broke your arm, you go to the hospital, you get sorted. It'd be very difficult with mental health. There's a problem. And it's sort of that talking and that dialogue is the early steps, the steps that for some may well be what stops them needing to go down a clinical route. And that is a huge area of healthcare across the board that we're seeing, of preventative healthcare and getting that there. So it's, I suppose, to throw a very difficult and unprepared question on you, do you see that as sort of the future of where we take mental health care, to be able to have this sort of all these options to provide a wide early sort of network, not just you have to pick up the courage to go and talk to a clinician.
Yes. So I share the message that a lot of guys from Andy's Man Club share, is that Andy's Man Club is one of the only clubs that tries really hard to hopefully not have the need to exist. I would love that if in 10 years Andy's Man Club does not exist because there's a generation of men and also women who are able to talk about their mental health in such a way that the institutions and charities like Andy's Man Club are not required, because they will know that they have a safe, confidential space to be able to go and share those feelings, whether it be with friends, family, loved ones, carers. But when we started, Andy's Man Club started off with the idea of hopefully we will not be needed, because there will be a future generation that is able to talk about these things openly and know that, you know, you're able to shift the conversation to the right place at the right time, and how to have the conversation, because you don't want to go hurtling in and be like, listen, I need to talk about X, Y, and Z, and if that other person's not prepared to talk about it, that's absolutely fine. But being able to approach it in the right way, to say, listen, could you set aside a bit of time during this week, because I'd like to have a bit of a chat. And that's really at the core of the kind of preventative measures, like you said, having a conversation that lasts maybe an hour, maybe 2 hours, that somebody feels like they don't then have to come to somebody like us, like Andy's Man Club, to be able to share deep stuff in a confidential space, if they know that they've got that option within their friends network, within their family, or even, like you said, in kind of an establishment that already exists, that has strong connotations with medical healthcare, like, you know, NHS private healthcare, to be able to use that in a way that they don't need to build up the courage to come to Andy's Man Club, get through the front door, because it does require a lot of courage and a lot of input. Yeah, man, like, it was a good question. I'm glad you asked it, but at the core of Andy's Man Club is, we hope to not exist, because we hope that we've done enough work to put in to the kind of a future generation that is able to talk happily and openly without that minimizing embarrassment, the banter side of things, the burden that mental health is. You don't want to burden somebody else with your mental health, because that it's very, very often is very much untrue. But I think at the moment we are still required, because it's very easy to talk to a group of strangers. Ironically, it's strange that some guys come to us and they tell us things that they've never told their closest friends. And, you know, we as a collective, we've probably known that person maybe an hour, 2 hours at most, but they share their deepest, darkest stuff, because it's in the right environment. It's very easy to talk to a stranger. But I think at the minute there still, unfortunately, exists that very much socially built barriers that men and women struggle to talk about their feelings, because they don't know when it's the right time to do it. They might not necessarily know how to do it. And until we kind of overcome that, unfortunately, we'll still be plugging away at Andy's Man Club.
Yeah, and I think, to be honest, with that being such a powerful sort of point, it's probably the perfect place to sort of leave the conversation that we've had. We've talked in such depth for it, and both myself and I'm sure our listeners really appreciate taking the time, Nick, for it. But it is about building that right space, that space that's people are able to share in, whoever that may be with. And I will say now, it's probably the only podcast I think I'll have had the discussion of the future with where we have said in 10 years, hopefully we don't exist. But it is true. It is very, very true and very apt, that sort of point, that hopefully we are in a situation in the future where the services and the opportunities available are far, far sort of more accessible and wider, and that is socially, medically, and across the board. As I say, both myself and I'm sure the listeners as well really appreciate taking the time, Nick. It's been fabulous to talk to you, and also really appreciate you taking the willingness to share your story with us, because that is a courageous thing to do. No matter how much you're happy to talk about it, it is still a big thing.
Thanks very much. That's really appreciated. Thank you very much.
Today's podcast is brought to you by our sponsor, Evo North, uniting leaders from the public and private sector to collaborate, share exciting innovations, and build a stronger Northern powerhouse together. Thanks for listening to this episode of NHE's Finger on the Pulse podcast. Join the conversation on social media or get in touch through the link on our website. To stay up to date with all the latest news and episodes, make sure to subscribe, drop us a rating on whatever streaming service you're using. This has been National Health Executive's Finger on the Pulse podcast. Thanks for listening, and I'll see you next time.